Hi, so I'm Harry. I'm based at University of Bristol, and I'm going to tell you a little bit about the Bristol findings from the support study that we're carrying out at the moment. I've only put my name up here, but I'd also like to acknowledge other colleagues at University of Bristol, Exeter, London School of Hygiene and Tropical Medicine, and Imperial, who are also supporting the project in the different research sites. And the overall, what we're hoping to do as part of the project is kind of help improve the way that at-risk young people get support for their mental health in community settings. And at risk, for the purpose of this study, we're talking about young people who are at risk of developing mental health problems, and we are adopting a very broad range of kind of risk factors, which might mean that that young person is more likely to develop mental health problems. So as part of the study, we're focusing in community settings. So we're kind of thinking about places that young people spend, which aren't their homes. So could be, for example, youth clubs or parks or blue spaces, but just really any place that isn't kind of school, isn't home, or isn't a healthcare setting. And these places can be good for young people's health, mental health, for lots of different reasons. We know that the kind of reasons that help and stop young people getting support for their mental health in community settings can be complicated. And rather than trying to kind of simplify this complexity, as part of this project, we wanted to kind of embrace the complexity and really get involved in all the kind of messiness of real life. And we are using a particular approach for this project to inform our work, which is a systems thinking approach. So the overall purpose of what we aspire to as part of this project is to help more young people get support for their mental health at an earlier stage, with the idea that this will mean that they're less likely to need treatment further down the line. And there's 3 parts of the study. So the first part is to understand the policy landscape and kind of do a lot of community engagement work to get feedback on the project from key stakeholders, and also start building up those relationships with the key people who are working with young people, or perhaps kind of have influence around decision making or in the kind of policy area. The second part, which I'm going to focus the conversation today, was to develop systems maps. And for this part of the study, we worked alongside young people aged 14 to 16, parents, carers, and professionals with a kind of role involved in supporting young people. And then the final phase of the study, which we're just starting at the moment, is to co-design a plan to kind of help more young people being able to get support in community settings if they want it. So there are 3 different study sites, and we've got some nice glossy pictures of the study sites. Tiverton, which is mid Devon, and we worked in a community within East Central Bristol, which are going to be related to the findings that I show you now. And we also worked in Ealing in London. So as part of the developing the systems map, we carried out workshops with young people, and we worked at a particular youth club in East Central Bristol, and we worked with 15 young people in total. We also worked with parents, carers, and professionals, and we worked with each group separately, and each carried out 2 workshops with each participant group. And that involved guiding participants through a series of exercises where they helped develop their own systems maps to kind of illustrate all the kind of different factors that can help and stop young people getting support for their mental health in the community. I'm now going to show you a very overwhelming, messy diagram, which is the combined systems map for Bristol. So this is a version of the systems map which takes everything that the maps that the young people developed, the practitioners and the parents, carers, and we combined all of the kind of the findings into one map. I'm not going to go into the detail of this big messy map, but what hopefully it does tell you is that actually the kind of reasons why young people are able to get support for their mental health in community settings is really complicated. But we'll now focus on one of the areas of the maps, which was kind of around young people's kind of personal development. So by having kind of tailored and inclusive community assets and services for young people to access, there was kind of two strands of how this could help young people. So it gave young people access to appropriate, enjoyable activities, which could improve their well-being, but also led to kind of new experiences, developing skills, giving them kind of some life direction and purpose. All of these different factors leading to young people feeling more confident and then building on their well-being. The other kind of key thing that kind of across all the different groups they talked about was the importance of young people spending time with a trusted adults, and being able to develop those kind of positive relationships with other adults, kind of which would help young people feeling supported, feeling emotionally safe, and then kind of also leading to improvements in their well-being. So any of you have kind of spent time in youth clubs who kind of know exactly what I'm talking about with kind of how places like youth clubs or other youth services can really kind of help give young people those kind of opportunities which they might not get kind of at home or in the school environment, and also that kind of time with a kind of trusted adult to kind of talk to as well. And then another kind of aspect which is kind of important to think about is the kind of the policy landscape and the kind of the environment of the youth sector workforce. So young people surprisingly didn't talk about this too much, but it was talked about at kind of in great detail by the youth practitioners especially. So there was discussions around the impact of austerity and how over the past 10, 12, 15 years, the kind of opportunities for funding for the community sector have reduced. And this has kind of led to a kind of disinvestment really in prevention, early intervention services, and this has led to kind of complex unmet social needs with young people, and this kind of leads through to kind of reducing kind of negatively impacting young people's well-being. There was also a great discussion about how this kind of impacted the organisations in the youth sector. So there was discussions around this, because of this lack of funding, what tended to happen was that the different organisations were kind of competing against each other for small pots of money, and this took up a lot of staff time, also kind of impacted their morale, but also meant that the staff impacted staff retention. So contracts will come to an end and there's no more funding to support staff, so staff would have to move on to different organisations. Whereas the other side of that is by having enough funding to kind of retain your staff and provide them training was meant that you could kind of develop a culturally competent, diverse workforce who would have a kind of greater understanding of the needs within the particular communities that the services or the community assets were placed, and this kind of helped ensure that the community assets and services would be kind of tailored and inclusive to meet the needs of the young people living in that community. So that's just a quick overview of some of the conversations we were having, and then one final kind of point that one of some of the discussions that we were having across all of the different groups was the kind of impact of community and how that could kind of negatively impact young people's well-being. So the area we worked with in Bristol, it's an area of concentrated violence, kind of high levels of crime as well, and this led to the young people being exposed to violence, potentially being exposed to kind of criminal activities taking place in public spaces, and together these kind of make young people vulnerable to exploitation, and that kind of vulnerability could potentially lead some young people to getting involved in antisocial activities. And then there was a bit of a tension between some of the conversations that we were having with young people and also with the parents and carers. So young people sometimes felt that adults would kind of had negative perceptions of them as young people or groups of young people hanging around in public spaces, and this kind of led to these negative interactions they might have, and feeling not able to spend time in public spaces, whereas adults sometimes felt threatened by groups of young people, so that maybe they had some kind of prejudices of their own about what it means for a young person to be in a public space, and these kind of interactions could lead to kind of a lack of trust for young people in by adults in community spaces, and all of this kind of leading to reductions in young people's well-being. So I've gone through that very quickly. I hope I haven't spoken too fast. So the next phase of the final phase of the study, which we're starting now, is the co-design study. We're still using this systems approach. So we'll be using the systems maps that we've developed, and we'll be carrying out workshops with young people again, parents and carers and professionals. And the plan of this part of the study is to design an intervention or kind of action points, really comprising actions at a policy level. So we want to kind of hopefully move away from changing things at a kind of individual level basis, but really trying to think about what are the kind of changes at a policy level that we need to make to kind of help improve the system, to help support more young people getting support for their mental health. So that's all from me now. I'll hand back over to Judy.